Imagine my face is going to be showing.
I just want to take a replay, sorry.
Face, I can hide this then.
You don't have to hide it.
I may just have to pick one or two strange words or not too familiar ones.
It's not just music, it's smooth music.
Love music, love life. Smooth 98.1. What it is.
Now, this is how your day starts.
Good morning!
Welcome to Smooth Breakfast.
An infotainment-packed show with just the right programming you need.
Exactly what I need.
By the way, don't forget traffic ahead.
Not today now.
And coming up around 6 is the headline news.
Business Express takes you on how government policies affect your financial decisions.
Get entertained on the grapevine for all your celebrity gist.
And it's more action.
On your favorite sport on the locker room.
And vent if you have to, because Lagos talks here on Smooth.
Earlier the government needs to address it, be better for everybody.
It's all that and more.
With music just for you to help you commute all the way to work. The Smooth Breakfast. Mondays to Fridays from 6 a.m.
Feed your mind and the rest
All right,
will
we
follow.
go live. So you can wear this. This will be a microphone. You
What does health look
put
like
it
to
to
me?
yourself.
Physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Okay. Feed your mind and the rest will follow. You're welcome to Soul Food right here on Smooth 98.1. Love music, love life. Now, if you are following us and you have been a part of the conversation before now, I said you should check out our status on WhatsApp, which is 0809-444-0981. That means you would have seen the flyer. Or if you're following us on Twitter or on Instagram, you would have seen the flyer as well. So why not give us a follow? That is Smooth 91 FM on Twitter and Smooth 91 on Instagram. This morning we're talking about eczema. Now, what you call eczema might not necessarily be eczema, and you're about to find out this morning, because once you hear the topic of eczema, if you're a Yoruba person, chances are that you will think, Ifo, well, is it that? You will get educated. Just hold on a bit. I have my guest in the studio, and you can see our faces on YouTube. So go to our YouTube channel, which is youtube.com/smooth91fm Lagos. Again, youtube.com/smooth91fm Lagos. That allows you to save it, share it with your family and friends, or people who are not in Nigeria. And also, it allows you to drop your comment, ask your questions. Now, you have the WhatsApp line that will allow you to ask your questions as well, which is 0809-444-0981. And there is a call line, which is 01-448-9981. That said, my guest is a consultant dermatologist and physician from the Lagos State University Teaching Hospital, and she is Dr. Oluwatomidimu Afolabi. Good morning.
Good morning.
How are you this morning?
Very fine, thank you.
All right, when I saw your face, I thought, okay, have I mispronounced your name? Thank you. Okay, now getting down to the topic, I'm waiting and itching to get into the separation between what has been called eczema before now and what eczema actually is. So, what exactly is the definition of eczema?
Thank you very much. I greet everyone listening this morning, and I'm going straight to the question and answering it. Eczema is actually a Greek word which means to boil out. So eczema is an acute form. Acute means the early state of an itchy skin. I'm trying as much as possible to use simple terms so that everybody can understand.
Okay.
So eczema actually can be used interchangeably with dermatitis. Derma means skin, itis means inflammation. So what are the signs of skin inflammation? When you say the skin is inflamed, one of the typical features of an inflamed skin is itchy skin. Then the skin can also become, we say weepy. Weepy means is wet, is exuding fluid. Can you see it's quite different from what people call eczema? So the skin is boiling, is angry. In some people, it can be red, it can be annoying. So a typical dermatitis, depending on how severe it is, can actually cause sleepless night. Yes, so that's what we call dermatitis. So dermatitis and eczema are actually used interchangeably, and it is quite different from what people believe to be eczema. And if I'm allowed to,
Please go ahead.
yeah, because of our time, thank you so much. So Yorubas call eczema ifo, but that's not what eczema is. That is what we dermatologists call pityriasis versicolor, which is a fungal infection. So pityriasis versicolor is actually the same thing as ifo and not eczema. Now the Hausas call it kiasfi. So kiasfi is similar to what the Yorubas call ifo, and it's the same thing as the fungal infection, which is not eczema. And then the Igbos call what Yorubas call ifo, what Hausas call kiasfi, they call it ogungwo or oboboa. I hope I pronounced it correctly. So that is a fungal infection, which is usually dry, is scaly. It can appear on the chest, or on the back, on the face, and it comes as a lighter, scaly, we call it macule, but allow me use the word patch, and it's just disfiguring and annoying, and that is what people call used to call eczema. So please, I would like you to change your mind and stop calling it eczema. You can just call it a fungal infection. Thank you.
Thank you so much for that, especially the effort you took in saying the names in the different languages so that they know what you're talking about. Thank you so much for that. And we hope somebody has a better idea of that now. Now, today is not the day for that versicolor. What's it?
Pityriasis versicolor, or simply you can call it PV.
All right, pityriasis versicolor, PV. Today is not for that day. Today we want to educate you on dermatitis, which is eczema. That is the real eczema. Now, you mentioned that it could be weepy, it could even cause sleepless nights, and it could really be horrible. So let's get started with the symptoms. How does a person know this is dermatitis?
Okay, so before I talk about the symptoms of dermatitis, I must first say that there are many, or there are different types of dermatitis. There's atopic dermatitis, there's seborrheic dermatitis, there's contact dermatitis. I can actually go on and on, but allow me just stop with these three. So let me explain atopic dermatitis, which is very common. 1 out of every 5 child most likely has atopic dermatitis, giving a prevalence of about 20%. So atopic dermatitis means a child, most of the time you see it in children less than 5, and you can also see in adults. So atopic dermatitis is characterized by itching, severe itching. I mean, itching that can be distressing, can be disturbing, and then most times you see it in front of the elbows, you see it at the back of the legs. It could also affect the neck. Now, this is the dermatitis part of it. Most times people with atopic dermatitis also have some other symptoms of allergy like itchy nose, itchy ears, itchy throats, itchy eyes. They sneeze a lot whenever they are in contact with fumes or with dust. They enter a dusty room. Perhaps you must think of somebody that enters a dusty room and sneezes like 5 times. Most likely the person has allergies. So that is the chest, the chest component of it, and the ear, the eyes. Now the skin component of it is what we call atopic dermatitis, and it is usually marked by a severely dry skin alongside the other rash and the itching that I mentioned. Now quickly, let me go to the other one, the seborrheic dermatitis. Seborrheic dermatitis is actually characterized by a lighter patch, what looks like pityriasis versicolor, PV, what looks like ifo, what looks like KSC, what looks like obubwa. But now it affects the eyebrow, a lighter patch in the eyebrow area at the corners of the nose. Sometimes it's associated with dandruff. So that's what we call seborrheic dermatitis. However, it also has a little bit of a fungal component. So the treatment is totally different from that of atopic dermatitis, but both of them have a degree of inflammation, and that's why we call them dermatitis. And then the third one is the contact dermatitis. For contact dermatitis is an inflammation, that is an irritation. I've explained the meaning of inflammation. You know, it's reddish, it's itchy, it can be weepy, that occur following a contact with something. I'm going to give you a typical example. I'm sure you must probably be aware of somebody that wears a earring, and then the earring the area begins to become itchy, it begins to exude fluid. So it's an irritation, inflammation as a result of contact with the nickel in the earring, or perhaps a ring, a wedding ring or a fashion ring. And some people, the buckle of their belt, once it makes contact with that part of the skin reacts. So that is just peculiar to some people. So that's what we call contact dermatitis.
Wow, thank you. I feel like you've taken us to class, and it is a very good class that I am so lost in it. Well, thank you for the, yeah, I was just staring, and then as you were painting the images in my mind, I was going back to a number of things and sites that I have seen, and it explains it further. Thank you so much. When you mentioned contact dermatitis, in my mind, I thought what I had was contagious dermatitis. So that brings me to is, just before we go ahead, dandruff. Can you touch a bit about dandruff? You said it is
one of the symptoms of seborrheic dermatitis.
All right.
And the treatment is the use of an antifungal agent. So dandruff can actually be properly treated, and it's not just by the use of all these shampoos with methyl. It's just one of the things people do. You hear all sorts of creams that people use to treat dandruff. It's actually a medical condition and can be taken care of with an antifungal shampoo. So when you hear shampoos, people think it's only for the scalp. We actually use shampoos also on the skin for treatment of seborrheic dermatitis.
Thank you. But is it contagious?
No, it isn't.
Ah, nice. We'll continue that. So let's talk about the causes of this types of dermatitis, because I would like to believe that the cause will determine its treatment. So exactly. What are the causes of this different, especially the three types of dermatitis you've mentioned?
Thank you very much. So let me talk about atopic dermatitis. For somebody to have atopic dermatitis, most likely your mom or your dad has it or has the symptom. So they must have passed it over to you one way or the other. So apart from that, in addition to the, we call it the genetic tendency, that is most likely your mom or your dad has it. Another history that I forgot to mention earlier on is history of asthma. It's also a sign of allergy. So you can see a patient with skin rash, has history of asthma, has the itchy eyes, the itchy nose, the itchy throat I talked about. It ties it up together and makes you more sure of your diagnosis that this is atopic dermatitis. So there's usually a family history, a genetic predisposition, alongside with environmental factors. So the environmental factors include the allergens like house dust mites, dust, fumes. You see people sneezing when they wake up in the morning, or they open their windows, cold air, and the likes. So that is the cause. And for the atopic dermatitis, I must say that using wrong skin products on your skin, wrong soaps, wrong bathing soaps, using the wrong body cream can worsen the atopic dermatitis, while just making the right choice of bathing soap and body cream can prevent or control or even terminate atopic dermatitis.
Thank you. That is interesting. Now, if you'd like to ask your question, please go ahead by sending it to WhatsApp. There is 0809-444-0981. That's the WhatsApp line, 0809-444-0981. And you can call 01448-9981. Again, 01448-9981. Austin on WhatsApp says eczema in Igbo language is called ugwo, or well, I'm guessing ugwo. I'm not sure I pronounced it well, but that was a suggestion. Well, thank you. And if you'd like to contribute to, the WhatsApp line is yours. Going further, I think you mentioned a little bit about the risk factor using cream, what you use, your body yeah.
cream and wrong bathing soaps.
All right. Aside that, are there any other risk factor that maybe can predispose or worsen these things in a person who already has it? As genetics looks like a risk factor to me.
Yeah, genetics is a risk factor, and then dust. So if you know you have a tendency for atopic dermatitis or the other components, rhinitis, you don't want to stay in a dusty area. You want to be mindful of the type of clothes you wear. You may want to stick with cotton clothes that can absorb sweat easily, things that don't readily irritate the skin, and you want to be comfortable.
Well, thank you. Now, how is this, before we even go to the treatment, how worse can these things get? You mentioned sleepless nights, and it was just a sight that I didn't want to have in my head again, because I can't imagine somebody itching so bad. That means they would have blisters, right?
Yes, the early phase of atopic dermatitis can show up with blisters, and then it becomes dried up, that is, becomes crusted, and actually that's the acute phase. But when it goes on for a long time, say 3 months, 6 months, the skin changes. It becomes thickened, it becomes dry, it becomes scaly and severely itchy, and that's what actually causes the sleepless night. You can imagine a child waking up in the middle of the night telling the mother, "Mom, help me itch my skin." It's quite bad, or it could be that severe. In fact, it's one of the reasons why some children may not be able to go to school. Their parents may also not be able to go to work because they have to bring them every now and then to see the dermatologist. But this can be prevented, this can be controlled if attended to on time.
Can adults suddenly develop dermatitis?
Okay, so for atopic dermatitis, there's something called adult onset atopic dermatitis, although it accounts for just a very little percentage. It's not all that common. But adults cannot have seborrheic dermatitis. In fact, you see that more in adolescents because oil, sebum, as a result of adolescence, hormonal changes brings that up. And then for contact dermatitis, you see people wearing earrings, chains. Some people wear necklaces and they develop rash along that area where the necklace is making contact with the skin. So adults can develop dermatitis.
Oh, thank you. Okay, then let's keep to the treatments then. How do you get rid? Do you ever get rid of dermatitis, or it just stays there and you keep managing it?
Okay, so dermatitis, as I said, inflammation of the skin. Before you treat it, you want to know the cause.
Yeah.
So it is important that you see the right person that makes the right diagnosis and gives you the right treatment. So the treatment for atopic dermatitis is not the same as the treatment for seborrheic dermatitis and the other types of dermatitis I've not even mentioned. So for atopic dermatitis, the very first important thing is using the right skincare products, which is your body cream. You need a body cream that is not bleaching, that is not irritating, that won't add more problem or more salt to the injury. And then you need the right soap. So we encourage the use of oily soaps, soaps that are non-medicated. I'm sure a lot of people will be wondering, I thought medicated soap is the right soap. So non-medicated soap. We only prescribe medicated soaps on rare occasions. And at this junction, I would want to say avoid just using any over-the-counter prescriptions. Like there are the triple combination creams people tend to use for almost any skin lesion they see. These triple combination creams contain clobetasol most of the time. So please look at the products you buy. Once you see clobetasol, neomycin, clotrimazole, those are the creams we are telling you to be you should be very careful for. They appear to work, but they cause flare after some time. The problem appears to have gone, but it's just a matter of time. It comes back, and it comes back in 100-fold. So please, we have to be very careful of what we apply to our skin. It's better you see a dermatologist or a doctor before you buy just any prescription and apply it to the skin. So in summary, the treatment for atopic dermatitis stems from the cream, the bathing soap, and then we prescribe steroids occasionally, but in a controlled form. We don't go for the triple. You will rarely see a dermatologist prescribe a triple combination cream. And then for contact dermatitis, you have to avoid what is causing the problem. So if your hearing is giving you issue, you remove the hearing. If your shoes are giving you dermatitis, you change the shoes. And then for seborrheic dermatitis, we give antifungal agents. I wouldn't want to mention any brand right now.
Yeah, so that they don't go in search of them instead.
Exactly.
All right, thank you so much. We see your messages. We will save your contacts so that you can be a part of the WhatsApp family. But if you'd like to ask anything, yes, the WhatsApp line is open as well. We've got about 5 more minutes to wrap this up. You can send your messages or you can call 014489981. Now, speaking about this, there was a place I came across something saying that stress can cause a trigger or it can flare dermatitis. Is that true?
To an extent. Stress contributes a whole lot to a lot of skin problems, stemming down from, allow me to deviate a bit, from acne. I've seen a patient that I treated, placed on every medication, but she was really stressed up and her acne was not just doing well. So she went on leave and came back and told me the acne had gone. So that is to show that stress has a lot of role, even in seborrheic dermatitis, atopic dermatitis. Stress has a lot of role in worsening skin conditions.
And I'm guessing diet too, especially if a person is allergic, you wouldn't want to eat something that triggers your allergy, and then by extension, I'm guessing it will affect the dermatitis as well.
You're very correct. So at this junction, there's something called food allergies, which is just one of the minor criteria for making the diagnosis of atopic dermatitis. So you see some people, they eat crayfish or shrimps and they develop rash.
Yeah.
You see some people eat granuts or not, they develop rash. You see some people take pineapple or smoothies and they develop rash. So that is what we call food allergy, which is just one of the components or possibilities in people with atopic dermatitis. So if that's the situation, you avoid it. However, there might be a time in which you get desensitized to it, that you eat it and nothing happens. But in the initial phase, it might be alarming and scary. So it's better you avoid it.
If you're one of those who eat anything and nothing happens, nothing funny happens within you, you better go and share testimony and give thanks, because that is not something everybody can do and get away with. Well, there is this thing that I've been meaning to ask. What is that thing that happens when a person has a bath and their body itches?
Okay,
After?
thank you so much. So we call that bath-related pruritus. Pruritus means itching, bath-related itching. So there are many things that could be responsible, stemming down from the sponge you use. So some people don't want hard sponge, because scrubbing yourself with sponge, as if to say probably you fell inside a ditch. Sorry about that. It's not necessary for you to really scrub yourself. You just need a soap to cleanse the body. And that's fine. So over scrubbing the skin can trigger some chemicals in the body. We call them mediators in the body that is responsible for itching. So that's just one. The sponge you use, the type of water you use. So some water, we call them hard water. If that's the situation, applying some chemicals, treating the water can improve that. Then the soap you use, some soaps can be irritants. They can be irritating and make you itch. Then vigorous toweling also can stimulate some chemicals in the skin that is responsible for itching. But I can go on and on because of our time. One of the very good things to do is immediately you have your bath, you come out, apply an emollient. Emollient is the same thing as an oily cream. It helps to seal the pores and calms down the itching. And there are other things you could do. Please see your dermatologist.
All right. Thank you. Still on the topic of itching, Michael on WhatsApp says, is it normal for the skin to itch due to prolonged use of stockings? When you wear stockings for long, is it normal for the skin to itch?
It could. Thank you for that question, Michael. So, use of tight fitting clothes, anything that clings to the body, can sensitize these mediators I just talked about. So, there are times you wear a tight jean and you remove it and it's itchy. Just apply emollients. Emollients, they are things like petrolatum or oils. I'm trying not to mention any brand. Coconut oil should be fine.
Okay.
Or paraffin or petrolatum. You should get a lot of relief.
All right, thank you. And the last one from Cisco Delgado says, yes, each time I am anxious or under anxiety, acne will always come to my skin, especially my face. Oh, well, hopefully you stay out of the stressful conditions. We are out of time and we are done. Thank you so much for all your contributions. Now, are you active on social media? You're not? Because I was about to ask if people want to keep up with you or, you know, ask for the questions on your social media. How can they do that? But you're not active. Or is there any way they can reach you?
Okay, I can give you my email.
All right.
So my email is dolutomi@yahoo.com. DOLUTOMI@yahoo.com.
Thank you very much, Dr. Oluwatomidimu Afolabi.
Yeah, Olutomidimu.
Olutomidimu. Or my apologies. Thank you. All right, thank you for listening. Now we've saved the video for you on YouTube, so you can go back to our YouTube channel to check it out and also to share with your family and friends, or maybe somebody you feel has this thing and you're not sure of what it is. Now you have headway and you can seek out the help of a dermatologist and you can live a healthy life, or a life filled with good quality. On the other side, which is in about 10 minutes, will be the show for the children, which we call Curious Minds, and it's for the children between 6 to 15 years of age. Tell them to come and have fun and learn, also to come and, well, get to know each other and learn how to speak their mother tongue, because there will always be that instruction where they have to speak their mother tongue to greet me and to answer some questions. Thank you. This is Smooth 98.1.
Yes. When it's game time, it's fun time. And when it's fun time, it's kids time.
Thank you so
kids
much.
think
That was,
dance
it was like,
Because it's not magic.
like inventing
No,
a
it
future
was
time
perfect.
machine of flying
It
to the
was-
moon
it was
with just a
really
cable.
good.
So I can
Thank you
discover
so
new
much.
land.
The Smooth 98.1 Studios presents Curious Minds as we explore the wonder
Yes, I'll
world
send
of
the link
today's
to you.
kids.
I want to be an astronaut, fortune teller.
Yes,
and
we
a
are.
doctor.
You hear what
Yes,
they
please.
hear,
I'm-
see what they see,
I
and
wasn't
know
too
what
nervous.
they know.
No, you were not
Something
nervous.
with jingle bells.
Well, even if you were, we did
Curious
not see
Minds,
it.
every Saturday from 8:40 a.m.
That's all, folks.